healthy life makes living so much easier and enjoyable. You're welcome to Healthline, proudly brought to you by Vodafone. Here are your doctors.
Hello everyone, my name is Ruth.
I'm Lorraine.
And hello, I'm Bright.
And I am Papani. Sickle cell anemia can be a sensitive and confusing subject. Today, we try to demystify this condition. You're welcome to ask what you want to know.
I'm sure our audience at home are wondering why I have lined up these red structures in front of me. Today, we're talking about sickle cell anemia. It's actually a disease that is of major concern, so long as we know there is no cure for this condition, and it's causing a lot of havoc. And I realized that it's something that can be avoided if people knew about what it is. Now, your blood is made up of cells, okay? We have what we call the red blood cell and the white blood cell. Now, the red blood cell is what carries oxygen to your body. Usually, this is what it looks like, and it's very flexible. So it can move and go anywhere it wants to go without getting stuck. In the case of people who have sickle cell disease, their cells kind of look like this. So they often, because of their shape, get trapped at certain places in the body, and they cause so many problems. There's a lot you can learn today, and I advise you stay glued to your set.
With that wonderful overview, we take an SMS. It says, "Dear doctors, my name is Lucy from Aoshi, and I'm a mother of 3. My third child is now 3 years old. Since she was born, she has not been growing properly. She always gets sick and her eyes become yellow. I was told she has sickle cell. I'm really worried about what kind of disease this is. Please advise."
Basically, sickle cell is a disease that you inherit from your parents, okay? And it basically is as a result of the fact that you don't have enough red blood cells. Now, it's known that these red blood cells, which are the normal red blood cells, live for about 120 days. And then the sickle cells live for only 10 to 20 days. So you can imagine if cells that are supposed to live for 120 days are living for only 10 to 20 days, then there is a big problem. So in the case of your child falling sick, there's a problem that sickle cells cause to the spleen. Sometimes they cause the spleen to actually fail. The spleen is known to be a very important organ for removing all infections or germs that enter the body. So if the spleen is absent or spoiled, then the child becomes predisposed to every small infection that a normal child wouldn't get. Now, as you mentioned, your child usually has yellow eyes. This is just because the sickle cells cannot last long in the bloodstream. Sometimes they actually get broken down, and they release something called bilirubin, which actually colors the eyes yellow. That's why you actually see your child having yellow eyes. And finally, the reason your child is not growing well is obviously because of the infections and the fact that your child does not have enough blood because of the sickle cells being broken down too soon. So, Lucy, if you have any problems with your child, just make sure you see your doctor as soon as possible, and things will be taken care of.
I think we have a caller now.
Hello, my name is Ketaba, and I live in Akwitia. My mother was a sickler, and she died when she had me. But I am not a sickler. I am afraid that my children will become sicklers because they are saying it runs in the family.
Well, Kisaba, you are right if you say sickle cell runs in the family, because it's one of the conditions we call hereditary, meaning that you acquire it from your parents. Now, there are some things we call genes, and everybody has genes. Genes are basically things that determine what you would look like. It would determine how tall you are. It will determine every characteristic you have. So there are even genes that determine the kind of blood that runs through your veins. In this particular case, the genes for sickle cell, you get one from mommy and one from daddy. And then the two you get combined and it becomes yours, which you can also transfer to your children when you marry and have children. So I'm going to use Papani to represent Daddy, and then Lorraine to represent Mommy in explaining how sickle cell comes about and how you can transmit it to your children. In your case, your mommy was a sickler, meaning that she was SS or SC, meaning she had sickle cell disease, okay? What happens in your case is that because all your mommy has is S and S, or S or C, she can only give you one of those. So you are likely definitely to have an S or a C from your mother, all right? Now, we don't know your daddy's condition, but because you don't have sickle cell, I'm sure that your daddy is probably having an A gene somewhere, which he gave to you. So by that, we conclude that you are a carrier of the sickle gene. So if you're worried about whether or not your children are going to get sickle cell, then we need to find out from your husband. At least we know that you are likely to be a carrier because your mother was a sickler, all right? So if your husband is a sickler or a carrier, then there's a high probability that you can give it to your children. However, if your husband is not a sickler, meaning that your husband has AA, then for each child you have, there is a 75% chance that the child will not be a sickler. If, however, your husband is a carrier, as in is another one like you, it's another AS or AC, then for every child you have, there is a 50% chance that they could be a sickler. Sickle cell can be very, very confusing. Genetics, not a very interesting thing. But the simplest thing is, now that you already have the children, send them to the hospital and let them get tested. If they have sickle cell, they'll pick up from there.
So Kitsaba, we're really sorry to hear that your mom died while giving birth to you, but this is one of the realities that people with sickle cell face on a daily basis. Their complications of their problems can actually kill them at any time. Giving birth is not an exempted situation. So as we talk and as we educate you here, I'm sure you will find out that some of these complications can actually be that serious.
Okay, we have an SMS, which is from Victor from Kade. He says, "Hello, doctors. I'm 15 years old and a sickler. Of late, I limp and have a lot of pain in my right hip. I haven't fallen down, so I wonder what is happening to me."
You see, Victor, you're suffering from one of the complications of sickle cell. Let me show you something. Okay, you said you have pain in your hip, right? So this here is a model of your hip. These are your hip bones, and then this is your thigh bone over here. Now, your thigh bone is connected to your hip bone through this small ball joint over here and through this extension. Now, in your body, there's a lot of muscle and tissue holding this joint in place. But in addition, there are also a lot of blood vessels in this place that go around in a wavy, curvy fashion to keep the bones nourished. They send oxygen and all the necessary nutrients that the bones needs to survive. A normal red cell can just navigate around, bend itself, go around the curves and things. But with a sickle cell, it can't do that. So in this case, whenever the sickle cell starts moving around these curved areas with the blood vessels, it gets stuck at some point. And once it gets stuck, it starts blocking the blood supply that supplies the bone in that area. So what happens now is that there is a loss of oxygen and a loss of nutrients. So then what happens to the bone? The bone starts to die. It usually hits the bone with the thigh bone over here, around the ball joints, what we term the head. So then you start having slow death of the bone over there. In the process, you will feel pain. If you don't have this thing addressed as soon as possible, the danger that lies within is that the bone can actually break, and you can actually have a very dangerous problem on your hands.
It's very important you see a doctor so that they could outline the likely measures or take to control this. In some places, the best thing they could do for you is actually a hip replacement, because if the whole hip joint is spoiled, it's not going to function as it should. So the hip replacement, they take out the ball and sometimes replace the sockets, get you a new one, and that can at least function better for you.
Time now for our Kids Corner segment.
Today, we're telling you about how you can handle living with a child with sickle cell and how you can take care of them effectively so that their recurrence crises are reduced to the barest minimum.
Most of the time, children who keep coming to the hospital over and over again are just not cared for in the manner that's recommended for sickle cell children. For example, we tell you that your children who have sickle cell cannot tolerate as much cold. So if it's a rainy day, we expect that you put them in shirts that have long sleeves up to their cuffs and trousers instead of shorts, so that they don't have to feel cold, because when they feel cold, they can get a crisis. Extremes of temperature, not just the cold, when they get too warm, they can also get a crisis. And then you also advise that have them drink a lot of water, even when they don't want to. So you have to prompt them. If you can sweeten the water once in a while with something to make it a little more attractive, why not? The bottom line is that you need to hydrate your child with sickle cell.
You know, as a parent, one of the things you must really take notice of are one of the very important triggers of crisis or pain in your children, and that's infections. So you have to make sure that the water your child is drinking is very well treated and is not likely to incite any episodes of diarrhea or any abdominal pain or anything. And the food, always make sure that the food you're giving them is heated and it's free of any possible bacteria. And then, of course, what do we have in our community? Malaria. Make sure that your children with sickle cell, especially, sleep in insecticide-treated nests.
Now, parents, the good news is that in most of the hospitals in the country, there are what we call sickle cell clinics. Now, these are specialized clinics that take care of your children that have sickle cell anemia. Now, I'm coming to tell you about a few problems that if you find your children experiencing these things, you should rush them to the hospital immediately because it could be an emergency. So if your child is experiencing unexplained pain, especially in the chest or in any of the joints or bones, or even in the abdomen, you should rush your child to the hospital immediately. If your child also experiences fever, this could actually be the indication of impending infection, and your child should rush to the hospital as soon as possible. If your child also has swelling of the hands and feet, if you also notice your child has pale skin or the nail beds are also looking white, if you also realize your child has any signs of stroke, for instance, is paralyzed or shows some paralysis on one side of the face or weakness in the hand or leg on the same side, these are very urgent signs for you to rush your child to the emergency.
Also, children with sickle cell anemia are put on daily folic acid tablets. And this is because they need folic acid to make the blood cells that they are breaking up every single day. So despite the fact that they get some folic acid from their food, it's not enough because they make blood at a faster rate than people who do not have sickle cell. So what we're saying is that don't forget to make sure you administer the folic acid every day to your child.
Life is a precious gift. Help protect it with a simple call to the Healthline call center 255. You will get expert medical advice that may save a life today. Let's take a break.
Oh, baby, I'm sorry. What is it?
One for international calls, this for cheap calls to any network, and this because I hear better.
Like, seriously? Duh. Listen, you need to choose Vodafone Red. No one beats Vodafone network quality. When you're on Vodafone Red, you get more minutes to call your Inter on Vodafone and your Exter on other networks. Your brother who's abroad, test your roommates, browse the net, and you get all this for as little as 5 Ghana cedis. And the Red experience that comes with it, discounts on movie tickets, free browsing at internet cafes, and you can get tickets to Vodafone events and parties. Close your mouth. Now before you break another nail, dial *200# to subscribe to Vodafone Red.
Vodafone, power to you.
Let's join Papa Ni on the street.
Welcome to another Street Doctor segment. For those who live in the tropical and more hotter regions of Africa and the rest of the world, heat stroke is a very common problem. Today, I want to find out what you know about heat stroke and what you would do if you are faced with that situation. Let's find out. What's your name?
My name is Theophilus Nilate Aulete.
Do you know what heat stroke is?
Heat stroke, yeah, I've heard of heat stroke.
See, what's that?
It's a condition which normally occurs when the body is not able to regulate the temperature.
So how would you treat heat stroke?
A cold drink or get a quick shower for the person. Yeah. Like our mothers do when we have high temperature.
Yes.
Yeah.
Right, okay. Thank you very much, sir.
You're welcome.
What's your name?
I'm Philip Anthony Mensa. I'm Isa.
My name is Agboga Emilia.
Do you know what heat stroke is?
No.
You haven't heard of heat stroke before?
No, I don't.
Oh, I don't have an idea.
You don't have an idea?
No, not at all.
So let's say you have a friend who's extremely hot, complaining of dizziness and tiredness, and maybe he's not sweating. What would you do for them?
take a cold shower or something.
Oh, I just told them that you should relax and you take small water and then you'll be okay.
First thing, I'll try to give them a first aid by soaking a towel or wetting any material to cover the person first. Yeah.
Thank you.
Thank you very much.
To avoid heat stroke in our hot climate, it is important to not overexert yourself, drink plenty of water, wear loose clothing, protect yourself from the sun by using a hat or umbrella, open windows and use fans and air conditioners, avoid caffeine and alcohol, which causes dehydration. If you suspect someone has a heat stroke, immediately make plans to get them to the hospital. In the meantime, move them to an air-conditioned environment or at least a cool, shady area. Remove all unnecessary clothing. Fan the patient while wetting their skin with water. Ice packs can also be used, or immerse the patient in a tub or put them under a cold shower. And remember, don't take the heat lightly. It can be dangerous to your health.
Thank you, Papani. Yasmin was born with sickle cell anemia. How has she managed this condition over these years? She's here to share her experience. Yasmin, you're welcome to the studio.
Thank you.
We just want to talk about sickle cell and how it's been in your life, okay? But first of all, we'd like to know, growing up with sickle cell anemia, how was it?
Growing up with sickle, well, I was diagnosed when I was 3 months old. So growing up, I had always known that I had sickle. I was in and out of school sometimes. There were certain things that I couldn't do. For example, I was told not to swim. But as a child, everything you're told not to do, you do it. So I'll swim and I'll come back home and I'll go into crisis. PE in school was difficult because I couldn't do strenuous activities because as soon as I get dehydrated, I go into a crisis. So growing up, it was tough at some points, but it was not bad. My parents just insisted I led a normal life like everyone else, but there were certain things that I couldn't do. It was not too bad.
It was quite a challenge when growing up, knowing
growing
about
up, yeah, it was a challenge because you spend a lot of time in hospital. So sometimes you're out of school for like a term or 2 weeks, and then by the time you go back, everyone is ahead, and then you need to catch up. For example, my 10th birthday, I spent it in Kolibu. I had a fantastic party in Kolibu, but I was on admission. Sometimes there are parties you want to go to, you want to do sleepovers, but I couldn't do any of that because it was just always something happens on the verge of crisis or you go into crisis. So.
Things may not be the same quite now.
No. When I was younger, you're told what to do, what not to do. But as I grew older, I started to learn sickle. I mean, sickle is my life. So I like to know when my doctors say A, B is happening, I like to have known it already.
Okay.
Sometimes I go into hospital, I know what's wrong with me. I can say, okay, I've got an infection, my white blood count is high. Can we do a blood culture to find out what kind of infection I've got? So growing up, I learned to manage it more. But I mean, during my teenage years, I rebelled. I mean, I was not supposed to drink, I drank. I'll drink and I'll go into crisis. And then, hey, I get over it. Everything I was not supposed to do, I did.
Now you've passed this phase of childhood and you're very much an adult. How are you handling things differently?
I'm handling things differently because now I understand sickle. I know my condition, I know what triggers it. I spray my room every evening, I use mosquito repellent. When I'm tired, and I hydrate a lot. I mean, I drink up to 8 bottles of water, the small bottle per day. So I make sure I'm well hydrated. I check my hemoglobin level, which is my blood level, to make sure that I'm not anemic. So I do a lot just to make sure that I don't go into crisis.
I'm sure a lot of people are out there watching who are sickle cell disease patients. Nevertheless, we'd like to know from you, what advice would you give them?
For me, it's knowing your body. Know sickle, be sickle aware. Question every single thing your doctors do. Why am I being given this? Why am I given that? Don't take any medication without reading the literature in the medication. I mean, that's what I do. Just know sickle, research, and then know yourself.
Last year on the program, we introduced you to Elias from Kintampo. Let's have a recap of his story and meet up with him a year down the line.
Mama wo Elias no na yare no ni ho. Da kuro bi na me kwa fumba ya ma hunu se ase ahono ketewa bi. Na me posa so a enkoye. Nti wo nyine na ade no so enyine. Ya de na akọ doctor saa bre. Na afede o mba kire letter ma yese yemfa na mrata mali hospital. Na doctor bi wo ho betimi asane yare ya mai. Me pa cho school no so na ya me de ne koye. Ne yankofo no omukọ ho ana omomiamia yare no so. Omumia so sa na oba fia na osan sunsenity ya ne ya efiri ho na meyi ne school be ya afini a mama na agya na wo nestle ti anka afi we na nko ko nestle ne yare no ewo mu adakuro bi na wo sunsenity ya ne ya obesun be 3 days na agya so a wotimi di agoro kama unhunu se wo yare
I people I bobo Janet. I Janet and Pepper. I moon bangus. I am Tiamia. Walk Miss Uncle Kayam or the Marco doctor. I am a down with who I am a born. Young so we are war. I will go to.
Dema huma nyina amanya me se nyame wamboa me na me mpie doctor papa so na want me nsa me ba we yade.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. When he was 10, Elias was diagnosed with an aneurysmal bone cyst, a swelling between the two bone layers in the skull. Without intervention, the swelling would continue and damage Elias's brain. Vodafone answered the call and stepped in to help Elias with his surgery. The bone and growth were removed from Elias's skull. The surgeon then had to reconstruct part of the skull. Vodafone would like to thank the staff of the Tamale Teaching Hospital for all they have done for Elias and his family. The team returns to Kintampo to find a very different Elias.
Elias said, "Yes, I said, you know, your operation by and then I near chick. Or calling young come out media or come. See, I can put my man up with school. I got that chimney say, operation now, or yeah, I didn't know how no beam dear. But how miss, made in home for swa.
When you say, I'm a young be. Mania did, why you want to come down for you don't dear girl. I could see a manager, I could see a dear girl. Now you don't get a pillow. I eat a bone. Mamma down for Sam. I may feel I won't see me being when you be. Mr. Madam,
see, dear, it's me. I can say, Tamana, your operation, if free Tamale by na doctor San Frame say, me fa colano lana, or me ha colano pomdi. Na me de a colano coy and a doctor catch me say, men San Bechot stand for now won't share a colano city in who sit in.
Elias is doing well and is now back in school.
Hello, boss. The presentation. If you read that too, sir.
It's amazing what you can achieve on Ghana's most reliable network.
Well done.
Yes.
Vodafone, power to you.
Tell us your myths and we'll get you the facts. It's time for Mythbusters. And we're taking a question from the audience.
Hello, doctors. I'm Ajwa. Is it true that as a sickle cell carrier, you are immune from malaria?
The thing is, if you're a sickle cell carrier, meaning that you have one sickle gene and one normal gene, all it does to you is that it confers some degree of protection against malaria. But this definitely does not make you immune.
Let me try and break this down for you, okay? You see your normal red cell over here. Malaria parasites, they like to eat normal red cells. So they come in and they fill it up and they go chomp, 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 and eat all the red cells and then make it burst, all right? Because they are eating all the hemoglobin and oxygen. They love that. But when you have a sickle cell like this, what happens is the moment the malaria parasites sit on the red cell, it realizes there's a problem. And with people who are carriers, that's the time that their cells sickle, whenever they're in extremely stressful situations. So yes, this would actually just sickle. And once this sickles like that, it takes away all the fun. The oxygen is lost. So the malaria parasites cannot survive, and then they go away. They die, more or less. So even though you will be exposed to malaria, the parasites don't even survive to be able to do anything to you because the cells will sickle, they will die, and the spleen will eat them up. So that's what builds your resistance as well.
Let's hear your health questions on HealthCam.
Okay, I told me some white. If you are a like woman bar, one only in no shishi. Naka a life, if you are a like bed, you stroke. Stroke, if you are a bonnet, but you could make a mobu, a gag baby. A common care mobu, a bar pumobo, now I will wobble. A common care mobu, a new. Ni me could make a one yearly me. Fufu, a go ye nimla, or none. You
have heard about stroke, and rightly so. You have mentioned a lot of the things that happen to people who get strokes. I explained to you how strokes occur. See, our brain is divided into two halves. The left side controls the right side, and then the right side controls the left side. The brain is kept alive by blood. And this blood travels through what we call blood vessels. People who get strokes, for one reason or the other, the blood vessel gets a clot that blocks the flow of the blood. So the part of the brain that is supplied by the blood vessel would eventually die off. And if it dies off, what it means is that the functions of the body that are controlled by that part of the brain also are lost. Occasionally, for some people, it's not a clot, but the blood vessel actually would burst open. And then the blood would flow out and cover a certain portion of the brain. And when it does that, that portion of the brain could also die off. And then consequently, you lose function that is related to that part of the brain. It's very common in people who have hypertension that is not well controlled. Yeah. And the people who also have high cholesterol are also at risk of getting strokes because it causes clots to form in your blood vessels. And like you said, diet is a very big risk factor in getting high cholesterol and also in managing your hypertension. So if you're eating anything you want to eat whenever you want to eat it, it predisposes you to very high cholesterol levels, and consequently, you could have a stroke. So if you want to avoid it, it goes without saying, control your hypertension, watch your lifestyle. If you smoke, you probably want to stop. If you're drinking excessively, you also want to go away from there. And if you have any condition for which you're being treated, you want to strictly adhere to your medications and also go for regular reviews so that you'll be fine and not have a stroke.
So, Samuel, there's not a direct link between eating fufu late and then stroke, that if someone comes, oh, you're eating fufu late, oh my God, you're going to get a stroke. No, it's not like that. It just means that you need to eat a very healthy diet. So you might want to watch that a little bit.
The following segment contains material of an adult nature. Viewer discretion is advised.
Right, we have an SMS, and this comes from an anonymous sender. She says, my husband masturbates every day, often when I'm at home with him. How can I make my husband choose me over masturbation? Your wife is competing with your hands. Shame on you.
This is a big problem. I mean, Imagine you probably come home, then your husband is there doing his own thing. It must be a terrible thing. What it is that probably your husband must have started this thing way before the marriage, so it's something he is addicted to. And for addictions, it's difficult to just break them off. You know, I think it really needs a lot of support from you, the wife, and a third person who would probably be a psychologist to speak to the two of you. So do well to have communication with your husband and try and convince him that this has to go to a different level where they can get counseling, so he can best understand that what he is doing is something that is not favoring the marriage.
In some cases, if you want, you could just try to assist him. You know, if as you're going for counseling, say, oh, let me help you out, or let me do this for you. Once in a while, you actually just make him feel a lot less secure about it. The feeling may just actually leave him altogether. You might want to try that out, okay?
So just lend him a hand, if you catch my drift.
We'll be back after the break.
What is it?
One for international calls, this for cheap calls to any network, and this because I hear better.
Like seriously? Listen, you need to choose Vodafone Red. No one beats Vodafone network quality. When you're on Vodafone Red, you get more minutes to call your Inter on Vodafone and your Exter on other networks. Your brother who's abroad, test your roommates, browse the net, and you get all this for as little as 5 Ghana cedis. And the Red experience that comes with it, discounts on movie tickets, free browsing at internet cafes, and you can get tickets to Vodafone events and parties. Close your mouth. Now before you break another nail, dial *200# to subscribe to Vodafone Red.
Vodafone, power to you.
Juliana confides in the team when they visit her in her home in Asene in the Eastern region. Watch this.
Juliana noticed a swelling on her eye 8 years ago. Over the years, it has grown huge. Doctors suspect it is a tumor and plan the treatment regime. Juliana lives in Asene, an agricultural region cultivating mainly cocoa and palm oil. The area can be described as the heart of hospitality in Ghana, as the people here are very polite and welcoming. Juliana fits in perfectly.
The bread started here. Now me te watch who I met it. Na me nik kabi. Me kun we no be 12 years ni. Anti yare na ba no na ayese pompo. Ayese pompo kitwe bi na esiwo. Nti ye de duro pompo duro ye ya anye yi. Nti o wa me nik kame, ekame. Nti me posapa na ye kese. Me posa na ye kese. Nti ye sa na me de ko hospital kese efens agugu. Na me ko ho. Nti me ko ye no anti ntam. Ana me sa ko efens sawom. Me go di 2 years. Eno so anti ntam. Ti baba ne se me kokolebu ti kolebu a na me ko ya na e ma me lete se e be operation to operation ni mo no e na me papa se ko be ya ma me e na me papa e di wuyi nti wuyi no so me anya busuani bia den anka so be ya ma me nti didi ma anti emu wo kra no me ye se me nyo bia anya ma me dia me koto aduru na ma no e na me sa kai se ebra maame na moja tu no finhia dumienu no onya na yaresa no me so dwira na pokua menya ayaresa na saa adwen ne ba metiri mo no efiri ho me dwen se me wo emma bi ho se me kasa me kwa kwa no aduru ewu a omo nso ombaye mobo na me di mani so to nkwala no na me chai omo amo mantemu wo no mo abonten omo humia empire no mbo mame Say, Sister Juliana, oh, Papa ya we inti. Who better what? She handle a mimianum. Basan. And yet, almost so I could come on Sassia, Bois, me quaqualebua, no fair. Now, we dear mammy. We may quite no way dear mammy, me bansua, Adriania midi, no my, no more dear mammy. Until you do me quite no shaman in say, and not almost soon. Dear, what Timawo, may I the Sicarina omu nibi, so one will be and call my mamma dada. To woman is canny. Tiana de Amoyadi was Adiano.
Her sister Ajwa remembers how Juliana was before she got sick.
Julie, first na didn't you, na Julie, or no awachi. We are watching. Or Pejuma, or Forso. Na I didn't start here. To me, Femco, a jam. Yabas is here on Yejuma. I said, on to me, Yejuma, on to me, Nadia, Eden. And we are so bad, na Yenija. Titembia no shede, tembia was shede.
Me huna na no hoye mmobo ka osisia no ontimi nya adwuma bia ne mba no nyina so onhu bebi kra ne mba no.
Rita is the only child that still lives with her mother.
Mama yare Terrible down more sanity. Or sin a come to me so that or down was sorry no drinking. Ya knows. The penama sola quacotin and wood. Mammy, I ran the banner. No many a penny in the corn, mammy back walk I saw. No many no toss me in sin and I be fan. It's in our come the number one nanachi.
A bra, yet if you know your any shame as sin. Sabrin na oyakola obo ne homoden ono anka sato na ade etimi de to aduane ne ne madi
first na ma me nyala no ono onyale na wo hwe mi pa mi ko school ale bibi o de mame bibi o timi de mamba na wo so ntumi nya adwuma na ne no ntumi fa nso ade na o de ato ade nti ene me penu me nya nya sa no de mame
o ye obi a obu ade o mpem tokwa na woni ne beka bia na osre na ne so bre adwuma setem bia o sore ya no koye ne adwuma na ne so kune ma ho o hwe ne ma no sa bre na na wonyare ye nyina na sa ne ma wo nyina wo ye
Semi ko kroma omo munnim no so omo hu manini sa ana omo atia na omo hwe me obi timi kra bisa me se oh ne de na ye o te sa na me so maye pasa te sa na makofi nti ya sa kwa no ntimi kra e de enko te fie nko ana me wo yo edu anadua se me di meti beto won ntimi fa meti ento nti se mani kagusu kakra bia eti a metimi na biom ti metna empa no so na de achi ewia ba mentimi mfa wia no so mentimi ensuo kra mentimi nkuta ensuo mentimi nseniema mentimi nya hwe nti se me wodam se pe na me wura ho se oh ti se na nyame bo me
nen de nisha eni ya pa na onaka sakra no ma no ofere se eni na ya because ya fan no na adena starting sa antino ewoma na owodem na osu
ni amehwe free senga menya ya nka mepene se yare ne be free ne so na wonya ne gi na wode atena se na wode ahwe ne ma no na adwen a wosusu wo ne tirim se yare ne nti wonya nko be no madura wo no e free ho watimi ene ne panyi na atena se asomdwe
me hia sese menya ayaresa na e bema mani agene se metimi aye adwuma se the first na me ye adwuma no na me nso me hu me nkwala na se de omo we ya fa na omo nyina abesa akabom na omo aba me nchen.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. Vodafone decided to help Juliana get her wish and sponsored her life-changing operation. Vodafone would like to thank the staff of Kolebu Teaching Hospital for all they have done for Juliana and her family.
So we are pretty happy with what we found at surgery. We think that it's a frontal mucocele, and mucocele is basically collection of fluid in the sinuses, and it's a benign condition, meaning that it's not cancerous. We've been able to drain all the fluid and also remove the mucosa. The mucosa is the lining of these spaces in the bone. Our next step is to do the reconstruction. We thought that it wasn't wise to do the reconstruction at the same time, because then we increase the risk of infection, and we don't want to put her through that. So we'll wait for about 4 to 6 weeks. I will come back with the plastic surgeons, and then we'll do a proper reconstruction surgery.
Vodafone will also take care of Juliana's next operation.
Welcome to the studio, Mr. Dompre, Madam Alice, and Auntie Juliana. Now, Auntie Juliana has had the first in a 2-part reconstructive surgery that will help her to look the way she's been dreaming to look all her life. Why, Papa?
That's it.
It's saying. Now, Auntie Julie, since you're there now, assistant, wapomu.
Me pacho, see the other song me pomo say. First na e wo na mintimin la. It is see no yi anu from mama no bitimi da.
Na ye o ya na se
na e ya me ya. Mintimi me no usuo kura enye yi. E di miti tu o se ya. E be me ya me na de achi.
Sisi si a wonte ya obi ya.
Sisi a de mente ya na mete.
Auntie Alice, sisi a unia no hu ne sen.
Ni aji.
Ni aji.
Se ye na etua mi nua na ho. Na nya asam keto. Se ye nam se ya bonso obi tumi ko no wahwe ye. Ni nyina na eya ahomti. Nso ene wadawro mane awrade ado. Ene obi hia na ehu se mi aba. Tumi so mani aji. Yes.
Ene Vodafone for. Almost oma boa wa. Emomomu nwie operation na kebi. Eno so mbehwe no so ama. Na emom bibi kakra ebe boa ma wo ko apomdie mu no ebe soso mu kakra na bibi esipe no omo bibi kakra bi ma. Nti we de Auntie Julie.
Ya wasida edma voda awani amaye no ho. Esi tuana mo wa na esiso. Yesu nyame adom. Oma beye dwumadi atise ya. Sene maka no. Ya wasida so kese e fa nyankopon so edma voda for ne amaye no ho.
We've come to the point where we say goodbye and thank you for staying with us. Until next time, remember that the decision to stay healthy is part of the cure. Stay good and stay fit. Goodbye.
If you have been moved by the stories or issues you've seen on Healthline, you can donate 1 Ghana cedi by texting GIVE to 133. If you want to donate more than 1 Ghana cedi, please dial *133# and follow the prompts. Next week on Healthline, our doctors talk about hypertension. In the field, the team meets Emmanuel and sees how his condition is affecting his schooling. In the Volta region, the team catches up with Janet from season 3 and see how she's doing now.
Vodafone. Power to you.
Vodafone is embarking on a new and very important project, Healthline 255, the Vodafone Medical Call Center. Today, Vodafone Foundation has made history in Africa with the introduction of Healthline 255. Healthline 255 is a medical call center run by doctors and nurses and powered by the world's best triage system that guarantees accurate medical advice to Vodafone customers in Ghana.
So how does it work? For Vodafone customers here in Ghana, for the first time ever, they can now pick up their phone for just £1 a minute and dial 255 to speak to a qualified doctor or nurse at the Healthline Medical Call Centre.
You could call simply because you want health information, probably about diabetes, hypertension, sickle cell, anything. You could also call for consultation. Say you have a cough, chest pain, headache, and you don't know what the problem could be. As soon as you call, the call agent or the health professional would have a question and answer session with you, where based on your answers, he or she would give you the appropriate health advice.
But that's the Vodafone Healthline Call Centre. The patrolling the same.
The Healthline Call Center is manned by a team of doctors and nurses who received extensive training over the past 4 months. The nurses and the doctors are from different specialties of clinical practice and speak various languages, which makes it easy for people of different languages to call into the call center.
Healthline 255 will help dispel the many myths around health in Ghana, reduce self-medication, and give expert advice to Vodafone customers.
The team of health professionals are supported by a cutting-edge technology known as Interflex. Interflex is a symptom-based clinical assessment tool which helps the professionals arrive at the most likely outcome. It generates a question based on the caller's symptom. With a response given by the caller, it generates the next question.
Thank you for calling. Yes, what's left now afraid doctor say who say no who say no. All of a sudden nobody know my beer would be afraid doctor let me actually on your house into no program in them say fine bad.
I would like to encourage all Ghanaians to take advantage of the Vodafone Healthline Call Center.
The power is literally within your own hands. So give us a call, 255, Monday to Sunday. We're available to take your calls every day between the hours of 4 to 10. We want to help you get the right advice that you need to help you stay healthy.
Healthline 255. Medical advice just a phone call away. Brought to you by Vodafone Ghana Foundation.